The Division of Hematology Oncology has a very important mission in relations to the medical school as well as to the hospital and the cancer center. We have a strong clinical mission, and that's taking care of patients with a whole variety of hematological and oncology problems. In addition to that, one of the things that distinguishes us is our multidisciplinary approach to care. So not only are we seeing the patients, but we're seeing the patients in conjunction, in combination with our other medical experts.
Both medical oncologists, cardiothoracic surgeon, pulmonologist, counselors, and palliative care team work together to provide a very good care.
Part of what we do in our division is help to devise and implement regimens for hematologic or solid malignancies, also any type of hematologic disorders. We work every day to help dispense medications. We actually make chemotherapies here in the hospital to help to treat our patients, as well as work with the physicians and other ancillary staff to choose the best regimens for our patients to hopefully provide the best outcomes.
We can offer our breast cancer patient with one-stop patient care and treatment.
We did our first transplant in 1992, and we are FACT accredited for autologous transplants.
We do all type of transplantation. We do the autologous as well as allogeneic bone marrow transplantation.
I'm the transplant coordinator, so that means I facilitate patients that are going to have a stem cell transplant. I start prior to transplant. I do their insurance approval, I do the workup, and then I walk them through the transplant process. So essentially I'm a navigator for them during the transplant. I also follow them post-transplant in the clinic. I'm their direct line of communication for when they have needs. They call me.
Every nurse we had, everybody that attended to me, we appreciated every one of them. Every one of them was great.
We have a strong educational component, and all of our faculty participate in the educational mission.
We work with the Department of Oncology, and we've just been learning about different types of cancers and focusing mostly on the different kinds of pharmacological treatments in use.
I'm also working with the clinical faculty like Dr. Kobos and Dr. Tihani. I'm working on seeing multiple myeloma patients with them.
We also have a fellowship program here in medical oncology.
Right now we have total of 3 fellows, and we are going to have 2 fellows a year. This is 2 years of training where we train the fellows how to take care and treat cancer patients, and also doing research in oncology field.
I get a lot of education in the outpatient setting, inpatient setting, and in the bone marrow transplant unit. I get exposed to diverse pathology. I feel I'm very lucky to have very supportive faculty and staff.
We also have the research arm of the division, which involves basic science research and also translational and clinical research to make these new treatments available for our cancer patients.
We have a very strong research which is supervised by Dr. Kariva. He has focused a lot on molecular, translational, and immunology research in oncology. Right now we try to get the clinical phase 1 trial open in addition to current phase 2 and phase 3 clinical trials. He has many students, including high school, college, grad student, medical student, and also our medical oncology fellows and internal medicine residents work in his lab.
I began work with Dr. Kariva this summer in the Division of Oncology. And what attracted me most to this department and Dr. Kariva's work is its translational emphasis. It's the study of these cancer testis antigens and their application in cancer vaccines. So it's great to see the bench work that adds up to the clinical treatments for our patients here.
I'm a second-year medical student. My long-term interest is in oncology, and so I'm kind of spending some time working on breast cancer research. I'm really excited about this opportunity that lets me combine both translational research with actual clinical practice. I think it's a fantastic opportunity, very motivated patients, and an excellent faculty. And this is very, very exciting for me. Thank you.